words about FemTech Lab, who we are and what we do. We are a global platform for innovators. We are supporting startups in women's health space, and our goal is to kind of help accelerate this amazing wave of products and innovations and help founders go to market, build successful partnerships and fundraise. We run 2 cohorts a year in spring and autumn, and our founders are supported by a network of over 250 mentors now, I think, over 400 investors, leading industry experts. We have corporate partners, and for this cohort, we have partnered with Essity, and we have also launched Angels Club to support earlier stage investment into women's health. We just closed applications for the autumn cohort, which will kick off on the 1st of September. We are still going through interviews, we're selecting startups, but if you're interested, you can apply for the spring cohort 2024, which will kick off in March 2024. So you can sign up on our website. But enough about us. Coming back to the topic of this webinar, I'm excited to present this fantastic panel, completely humbled and love that you're here with us today. So I'll because we are very limited on time, I'll go into introductions. So first of all, we're joined by Oana Gharbi. She's the head of partnerships at Proov. She's also leading EMEA global operations for EMEA-Carrot Fertility. In addition to that, Oana is also a FemTech business consultant and a passionate fertility patient advocate and a certified health coach. Oana, thank you very much for joining us all the way from Paris.
Thank you so much for having me. It's always a pleasure.
Indeed, for us as well. We're also joined by Nishant Varma, a serial entrepreneur with a very successful track record of building medical device businesses, scaling operations internationally, and ultimately taking his company through an exit, which would love to dive deeper into the details of that. But thank you very much, Nish, for joining all the way from New York.
Thank you for having me. Looking forward to it.
Brilliant, thank you. We're also joined by Wendy Powell, our own, very own alumni of FemTech Lab. Fantastic to have you with us. Very proud of MUTU System. Wendy is a founder of global health tech platform MUTU System, which is a digital platform for pregnancy and every step of motherhood. Very proud that MUTU System won Essity Ventures co-creation event and now runs in-market pilot with Essity. So also would love to dive deeper into that. And also we're joined by Alison. Alison Sneddon, employment lawyer and senior counsel at JQ Littler. And Alison works with companies and advising clients on employee benefits strategies. So guys, thank you so much. Extremely proud to have you here with us. So I'll start with a few questions to the panel, but guys, feel free. We would love to have this as useful to make this conversation as useful as we can for our founders who joined online. So feel free to add your questions, ideally in the Q&A chat, so we can keep track on those, and we'll get to questions very shortly. But let me kick off with a couple of questions. So my first question is, Oana, to you. You're leading partnerships for Proov, you're working with EMEA-Carrot Fertility, and you're also advising multiple FemTech startups. So I'm sure partnerships have been on your mind for a very long time now. Can you maybe share an example of the most successful partnership that you've had achieved so far? And some of the maybe like common mistakes, or what would you've done differently if you were to do it again?
Yes, so I can finally now talk about it because I received the same question in October and it was ongoing, but we couldn't make it public yet. So the most successful partnership we have signed so far at Proov is the one with Quest Diagnostics. Quest Diagnostics is an American clinical laboratory. They are a Fortune 500 company, and 1 in 3 adult Americans is being served by them. They have 50,000 employees, and we have worked a lot to get this deal. We're very proud to say that Proov is the first home test female health test that is being featured on Quest Diagnostic website. They usually do not work with third parties unless in very specific situations. They provide 75 types of different tests, but most of them are lab-based, offered by themselves. So for us, it was huge, and it's also a lot about obviously about reaching out to their customers, but it's also a matter of reputation, because when someone like Quest Diagnostics endorses you and puts you, chooses you as a partner, that means something about the product. Common mistakes or lesson learned. First of all, I think that sometimes the time is just not right. And we sometimes have expectations that do not match reality. And we sometimes, even especially as startups, we try to run before ever learning to walk. So if something just doesn't happen, maybe it's just not the right time. Corporates especially, they might be interested in a product, but if you're too early stage, maybe the time's not right. That doesn't mean that the door is closed forever with that potential partner. You may try again later when you have a more solid proof of concept, when you have more solid proof of traction. So this is the lesson I learned, not to take things personally. In terms of mistakes, I would say that startups, obviously, they're very proud about their products, and they sometimes tend to overemphasize the product. Whereas when you're talking to corporates, and this I've learned it the hard way, they are less interested in your product. They're more interested in what your product could do for them. So over the years, I've adapted my speech so that, instead of focusing on what the product is and does, I would focus on how the product can actually, solve their pain points and what it can do to grow their business, because that's that's where their interest lies first and foremost.
I love that. So the first point for everybody to make a note of is think about, research the company and think about what they need and how you can help them improve their ROI. Yes. Fantastic. Thank you. So just a quick maybe follow-up question on that. You said that Quest Diagnostic don't really partner with third parties, and it's a fantastic partnership to have. What kind of made that needle switch for Proov? What was the successful tip maybe that you can?
Well, first of all, it was a very nice introduction from one of our investors. Mm-hmm. Business, as in life in general, connections are very important. Like, we shouldn't beat about the bush. It's reality. And this is why we're doing networking here. Precisely, that's the reason why, because you need to know the right person. So for us, it was a good introduction. And then, of course, it was a lot of work, like you said, doing due diligence on the company, seeing what they're offering, understanding who their competitors are, understanding who their customers are, and what we as a company, as a startup, could bring new to the table, because that's the most important thing. That's how you convince them. What do you bring new to the table? Why would I take you? They do partner with third parties, but we are the first women's health diagnostic test. So that's awesome, I think. And there was a lot of work in it, because partnerships do not happen overnight. That's a fact. And, one might expect things to go sooner, quicker, but they just sometimes don't. And it may take months or even years to sign a deal. Yeah. But in the end, it would be worth it, right?
hopefully, right? That's what you want. You don't want to spend, because B2B sales cycle is notoriously long, and we all know that. So what you don't want to happen is to invest a lot of time in it and have nothing at the end. So how do you, and maybe we can we can come back to that question if you like later. And I think it's a question maybe to everybody to jump in. How can you make those conversations effective, and how do you know when to stop investing your time into this?
I mean, we have reached out, I've personally reached out to a lot of pharma companies, to a lot of corporates, and you kind of see immediately who has a genuine interest in you and who doesn't. You know, it's also about a gut feeling. Like if you see they're not getting back to you after a first meeting, and then you're reaching out to them like 10 times and they're still not getting back to you, there's no point in pursuing, you know, a venue that might potentially not offer you anything. I think it's also, I'll just say, go with the feeling.
Yeah, perfect. I love that. So second point is to kind of go to the earlier point of how do you even make that connection. Having an introduction is a fantastic way to start those conversations with the corporate. And when you choose your investors as well, to founders, quick note, when you're choosing your investors, choose investors, if you have a choice, of course, choose investors with connections who can connect you to the right people.
But I'd also say, you know, attend events, industry events. There are quite a lot. Like you are organizing a lot of events. There was a fantastic event you organized at the beginning of June in London, for example. There are congresses. That's how you meet people. You know, if someone doesn't reply to you on a LinkedIn message, which is most likely 90% the time the case,
Exactly.
You can make an appointment at a congress. You can make an appointment at a conference. They're there for that. So it's much easier to you know, to put a foot in the door.
Perfect. Thank you very much, Oana. And Oana is also a mentor, as all of the people here presented. I'm especially proud that all of these guys are mentors and partners of FemTech Lab. So thank you so much. Right. So I'll jump to the second question. Like I said, there are many ways to work with corporates. And Alison, you are working with clients, helping them work with employers, helping them on employee benefit strategies. What kind of, in your experience, first of all, how do startups even approach those conversations with employers? How do they get connected? Do they differentiate? Because I think for many women's health companies, working with employers is a very favorable path. However, it's hard to differentiate yourself. And also, if you can give us maybe some insights from internal wisdom, how do employers evaluate those startups?
Yeah, great course. Thanks, Tatiana. So to put it in context, I'm an employment lawyer and I work with HR and management teams who are implementing changes to their employee benefits and diversity and inclusion strategies. So we do quite a lot of work in the FemTech space around menopause and maternity support. I think two questions you've asked there. One is, how do you even get these contacts in the first place? Well, Oana's given examples of that. But I do think it's quite interesting to think outside the box as well. So we've been working with one of the founders from your previous cohort at Postpartum Plan, who provides employee benefit support. And we've teamed up to do a number of webinars and think about ways that we can give value to clients. And the founder of Postpartum Plan has came along to training sessions that we do for clients. So it's possibly not a natural pairing that you'd think, teaming up with a law firm or other HR consultants, but that's a good way of expanding your network. I think the key challenge when it comes down to this and actually closing it into a sale, and Oana's really hit the nail on the head with this, when you're a startup founder, and I do see this, people come into pitches very passionate about what they do, and there can sometimes be quite a long, awkward point on that call where you think you've not asked the client what they want, what they need, and there's a lot of information that you can arm yourself with to help that conversation go better. So some things, for example, many employers, they've got employee benefits processes in place. and they might already be able to get what you're trying to offer them through their existing health insurer. Have you explored that? Do you understand that? Do you know when their benefits window is? Because it might have just closed and now you're speaking to them a year too early. So I think keeping those open questions and trying to understand your client more can be really useful. And you also spoke about impact and return on investment. I think this is one of the hardest ones, as we spoke about. They want to know what you're going to do for them. Why is this beneficial for them? Because any corporate and any business have things to focus on over and above their employee benefit structure. And it's often a really hard one to get to the top of a priority unless you can show what impact or return on investment it's going to have. And that can be really hard to monetize, right? Because until you've tried it, sometimes you don't have a figure to say, oh, I know this is going to save you X amount of days off in absence, or X amount in terms of extra insurance or a different benefit. So what I do see that I think is quite powerful, when you can't basically monetize it and put a figure on it, can you show some useful statistics about employees leaving the workforce because of this issue, or changing employer to move somewhere that offers better benefits? And I think the favorite is always, can you say this is something your competitor is doing that you're not?
I love that. That's our third nugget of wisdom. Research what their competitors are doing and use that in your pitch. That's interesting. I love that. Alison, thank you so much. I think the point of, and I'd like to kind of come back to that and dig deeper, but I think return on investment is so relevant to pretty much any partnership that you'd like to go into, because all corporates, whatever the type of partnership they're going to, they want to see the return on their investment. And Nish, I think what was that kind of a big decision maker in your case? Because I think your example is the ultimate success for many founders, especially in women's health. It's not easy. We start seeing more and more exits, but still, I think yours was a couple of years ago now. So at that point, it wasn't a very popular kind of it didn't happen very often to have such a great exit into a US company, Cooper Surgical, I think, that you've sold to. Can you share a bit more about the journey, but maybe like with a specific angle of well, first of all, was it your end goal always from the beginning that you wanted to sell a fetal pillow? How did you approach those conversations? How did you build a pipeline of those potential buyers, if that was the case? And maybe some useful tips for our founders, like how, like what 80, if we think about 80-20, what makes the most difference in those conversations?
Yeah, I mean, there's so much I could share about our story. It's it's been an interesting journey for us. I think, just to give a very quick background, just so everyone's aware of our company and what we sort of did. It's my father's actually an obstetrician. He's been practicing for about 40 years. About 15 years ago, he came up with an idea for a medical device, which eventually ended up being called the fetal pillow. It's something you can probably Google if you're interested. It was a brand new innovation in the field of obstetrics. It was solving a problem that had never been solved before. It's essentially a device that helps women when they have second stage cesarean sections, which can be quite challenging, quite complicated. The baby can essentially get stuck in the pelvis. It requires a lot of force to get the baby out, which can lead to trauma to the baby and trauma to the mother. He came up with an idea of the fetal pillow, which is a balloon device that helps gently elevate the head out of the pelvis and then makes the cesarean section much easier to perform. So he came up with this idea 15 years ago. He partnered with someone from Johnson & Johnson who had a lot of experience in women's health. I had my own career in investment bank at the time. I then left my job and partnered with them as well. So there were three of us really running the business. Initially, we launched it into the UK, and our real goal was to eventually get into the US market, because that is, a big milestone. Really, our challenge was, how do we get FDA approval? So that was something that we were working towards for many years. And we got FDA clearance in 2017, and then we launched into the US market. I think in terms of our plan, did we always plan to sell the company? I think we were quite stubborn. We were quite confident in our product and the ability to build the business ourselves. I think the one problem that we sort of faced as a small company, if we really wanted to get this product out globally and help as many mothers and their babies as possible, we would really need to partner with a bigger player in the space. So I think as we started building the business and we gained traction in the US market, it started to become, you know, more sort of sensible that a bigger partner should take it forward. So that would essentially be the only way we could really do is get someone big on board. And Cooper Surgical, when they acquired the company back in March of 2021, you know, they've got sort of close to 100 sales reps in the US alone. So just putting that product into their hands would get out so much quicker than we were able to do ourselves. I don't know if that answers your question. I know there are a couple other questions in there.
Yeah, no, but I'd love to kind of dig deeper into that, because you're a UK startup. Did you go straight into the US market? Did you gain some traction here in the UK first to prove kind of to validate the product?
So we started off in the UK market. So we had a pretty we were pretty successful. It took many years to sort of get into the UK market and start build adoption. We were eventually able to do so. We obviously had to go through the regulatory process, get the CE mark. So we're selling in the UK, several European countries, also Australia, New Zealand was a big market for us. So we did build a business for probably, you know, 10 years or so, really, until we were acquired eventually. But we built the business in the UK, Europe, and those other countries for about 5 to 6 years. And at that time, alongside that, there were a lot of institutions that were publishing data on the product as well. So when we came to approach the FDA, at that point, we already had the CE mark. We had a track record of sales in the UK and other countries. We had a lot of clinical data, so we could essentially present that information to the FDA, and that really helped with the approval process. And then all of our efforts really became focused on the US market, because it really was the biggest market for us, just in terms of population size, the number of births that are that are done over there in the US market. So that really became the focus. And we knew that if we could prove our business model in the US market, that is typically where some of the bigger players are that are looking to acquire smaller companies, acquire new products, new technologies. So that's really where we started gaining traction and getting onto the radar of some of these larger companies. And I think you mentioned about, you know, how did the acquisition come about, and was it something that came about sort of suddenly? I think with Cooper Surgical, we attended a lot of US conferences, you know, even before we had the device cleared by the FDA. We would go and attend conferences, and we'd sort of meet with physicians, meet with companies, and share our story. Cooper Surgical actually were aware of us probably 8 years ago, so long before they acquired us, and we essentially just maintained a relationship with them, and that's a really important point for us. I think starting to build those relationships early, I think that was critical for us. So we had a good relationship with Cooper Surgical many years ago, and every year we'd be in the US at these conferences. We'd sort of catch up with them and give them an update on you know, how things are going for us. And it was always interesting to see the progress we had made year on year, and they could really see the traction that we were making. And once we got into the US market, we could see that they were keeping a closer eye on us to see how things were going over there. And once they started seeing that we were proving it in the US market, was when they started taking a keener interest in potentially you know, acquiring our product from us.
Thank you. And I remember like driving to what Oana said earlier about having attended events, meetings, conferences to build those contacts. I remember you said that also in the US you were researching and going to pretty much all of the conferences with relevant stakeholders.
Absolutely. That was critical for us, attending the big obstetric conferences. There's 2 or 3 large ones in the US each year. We made sure we were there, and we were, you know, nothing really beats that face-to-face interaction, you know, with clinicians, with potential companies that were interested maybe in acquiring the product at some point. So that was critical for us. I think being there in person, and not just clinicians or potential acquirers, but also we built a distributor network. So we worked with a lot of independent distributors, because, you know, it was limited what we could do from the UK. So we built up good relationships with distribution partners. So that was another important you know, piece of the puzzle for us, was how do we get our product out to the US? You know, one thing's having the FDA clearance, but actually commercializing it and marketing the product was you know, just as big a challenge, I think, for us.
Brilliant. I'm just checking the Q&A chat. Feel free to add your questions. We'll come to them shortly. There is one question, and I think it's for Alison. How well received are female-focused wellness programs by employers, and what are some of the apprehensions they have had in your experience?
Yeah, that's a good question. I think it depends on the employer, and I think a lot of that can come down to cost. So if you're dealing with a larger corporate and you can see, or even an employer where you can go on their website and their socials and see that they really engage with these changes, so they're signing up to pledges around support for women in the workplace or menopause support, you know, you're then dealing with people who have an interest in this. I think it will come down to cost as well, because some of the smaller businesses, they might not have employee benefit programs that are that developed. They might not offer extra medical insurance, for example. So if they're not giving extra medical support to employees that could have really serious conditions like cancer, they might not actually be interested in funding some benefits that they will see as smaller, nice to have. So I think invest your time researching that. I think one of the issues that does come up is if you're approaching an employer and saying, here's a benefit that we offer for women, be very mindful that they need to message that internally, and therefore there will be the inevitable question, even if they don't say it directly to you, how do we explain that we're not giving men any benefit? And that's where you have to be quite creative and think, well, is it something we can have available for partners? Or if it's fertility testing, are we also going to make that available for men? Or is it something that everyone gets? And this is what I've seen some clients do. All employees get a health and well-being allowance, and then they can decide to select certain benefits so that you don't actually leave them with a problem whereby they feel like women are being treated more favourably than men, which is quite hard for them to actually message.
Fantastic. Thank you very much, Alison. Feel free to add your questions, and we will continue. We have explored different types of partnerships. We looked at an exit, at employer benefits. We looked at B2B, B2B2C partnerships. And now, Wendy, over to you. I think it's really the way you have driven MUTU System you have bootstrapped for a long time, and then you've partnered, you won the co-creation challenge, you partnered with Essity, fully funded pilot, which is, I think, another way to partner with a corporate, right? And it's a good way to kind of get open the door and start those conversations. Can you share a bit more information? How did this pilot come about? How did this journey start with Essity?
Yeah, sure, happy to. So our MUTU's been in business for more than 10 years now. We don't have investors, as you mentioned, and our paid membership has always been majority from the USA. So we're UK based, but most of our customers are in the States. And then on this side of the pond, we've got links with the NHS, in the NHS Apps Library. I'm a fellow of the NIA, that kind of thing. So we kind of have a foot in both, really. And then this partnership came about, well, actually, initially from an introduction from FemTech Lab, because it was the first co-creation challenge they were running. This was November of last year. And so the process was an online application, an introduction, some due diligence, a panel interview, and then I was invited to the final, which was, I believe it was 7 companies sort of went to that final. And that was a great experience, because what happened during that was we were kind of each given, each company was given like a squad, they called it. So a squad of senior Essity employees that were relevant to your innovation. So for example, in our case, because we're not a startup, we're established, we've got a paid membership base, we're profitable. So we weren't in that sort of R&D stage, for example. So the people on my squad are sort of senior marketers and brand managers, whereas somebody that had an innovation that was more a device or in a more sort of startup phase was working with R&D people. So it was very well kind of, you were allocated people that were very relevant to where you were at. So that's how it came about. What we had to do was get together in our squads, and we were sort of given various challenges and had to then pitch to a panel, including the presidents of the company. And it was very much about, what was interesting about this was that this wasn't about just pitching your company. And I think the other panelists have mentioned this too. This was not about going in and saying, let me tell you about MUTU. You know, it wasn't about that. It was about, why is this relevant to you? And why is there a brand synergy and a mission synergy and a purpose synergy? Like, why does this fit? And that was very much the key to sort of making these pilots work. It was what does it do for them? Very much addressing, so it was with Essity, but we were encouraged to pick a brand, as it were, within the Essity stable, even though there might be a number of relevant ones. So, for example, in MUTU's case, we deal with postpartum symptoms around incontinence, prolapse, that kind of thing. And so we've started working with the Tenor team around incontinence. So it was kind of finding a synergy within a specific brand within there, and then we're running pilots with Tenor UK from there. So really it was about what do we bring to the table? Why it was almost like a, why do 2 and 2 make 5 or 6 or 10? It wasn't just they fit, hey, they're complementary, that's nice. It had to be together we are stronger. And that needed to be the vision. And what we needed to do, and what we're doing currently with this pilot, is driving that forward in terms of so what is the narrative here? It makes sense in our head as brand owners, as company owners, but does this, what is the narrative to the customer? Does this partnership make sense to our customers, both ours and theirs? Does this narrative make sense to the industry? Does it make sense to the market? So that's what we're exploring in this pilot is, okay, we've kind of done the rational logic of why these 2 companies or brands might fit, but how does that actually work out in the market? So that's the sort of the fun piece that we're getting to do now, which is testing and playing and trying different things, and sort of seeing what sort of reactions we get. So that's where we're at.
And what is the ultimate goal of the pilot?
Well, that is what we're figuring out right now, to be honest. So it's kind of, I mean, I think it was Nishant that mentioned as well about having a product where you know what you're providing to a level of customers, but what we want with MUTU is to be able to reach so many more. And because of the way that this company has grown, because we've done it organically, you know, we've got hundreds of thousands of members, not millions of members, but we could and should be helping millions of women. So this is for me, for MUTU, this is about how do we harness the resources, the might, if you like, of a much bigger partner, to take that solution, not both as MUTU alone, but also MUTU combined with other brands and other missions. How do we take that to many more? So what that looks like, it looks like a deeper partnership, but the actual sort of mechanics of that we're literally working on right now.
Fantastic. So Wendy, first of all, again, want to highlight that connections and introductions are super important, right?
For sure.
Being at the right place in the right time, whether it's going through an accelerator, whether it's going through the right connections and people and events, but trying to have those personal introductions it's super important. And then again, looking at the synergy, and I love what you said about kind of how does your mission, MUTU mission, and Essity mission and brand vision aligns. And I think this is a question to everybody. So we mentioned that the sales cycle can be a very long one, and Oana already touched on how we can kind of make it more effective. But now with like everybody else and Nish, I wonder if for you it's been a very straightforward journey with Cooper Surgical. You said it was 7 years, but how much of your time how much of your time have you wasted on useless conversations? And same for Wendy, like everybody feel free to jump in. How can we make those conversations more effective? How do we know? Because I heard from somebody that if you're not being introduced to a higher and higher and higher kind of level of hierarchy in the corporate company, if you keep talking to the same people, it's probably not going to go anywhere. So how can you progress? How are there any other tips to know if this conversation is going to go somewhere?
Yeah, I mean, I can add a couple of thoughts. I mean, for us, when we were selling into hospital systems in the US, for example, we were obviously selling to hospitals, but they were almost like corporates, and we really had to make sure we identified the right people that we should be speaking with. If you're, for example, a specific case for us is if you're going into a hospital, you may speak with several doctors, tell them about the product, and they would all agree this is a great product, but they should have it available in their hospital. But actually, they don't have any decision-making power. You had to identify who is the head of that department. For us, it was who is the head of the obstetrics department that can actually have influence and can bring in new products to that particular hospital. So for us, we were, as a small company, we were very efficient with our time and resources and made sure we directed our attention to the right places. So I think that was very important for us, if that helps at all.
I also remember that you mentioned, I think, was it like a head nurse that had more power sometimes, or had power to influence doctors?
Yeah, definitely. I mean, there were the doctors, there was also the nurses. They were also very involved in our product as well. It would be the doctors typically using the product, but the nurses would also be there to remind the doctor that we should consider using the fetal pillow in this particular case. So actually getting them on board as well did have a big influence in terms of adoption once you got the product into the hospital. So yeah, absolutely. That was very important for us as well.
Brilliant. Thank you. Wendy,
if I could add to that too, because this is actually it's relevant to corporate partnerships, but I'm thinking more in terms of, we have a lot of relationships within the NHS in the UK, and also I'm talking to medical insurers in the US. So very different, obviously, in terms of their agendas and their goals. But following on from what Nish was just saying about the having decision-making power, but it's not just to say yes, as it were, but if there's a no, if you're not at a high enough level, you're probably not going to get a transparent answer as to why, because and we've certainly found that within medical systems, because there's a lot of people are like, oh, this is great, this is really interesting, and you can spend a lot of time, waste a lot of time talking to a whole bunch of clinicians and management and things like that within the ecosystem, and not only do they not have probably the authority to spend anyway, or to make that decision, but if it is a no, you're never really going to know why. So that makes it even more of a waste of time, because it's sort of, if you're at a senior enough level, what I've found, and this relates to both US and UK medical systems, is you're more likely to get some actual productive feedback about why this didn't quite fit right now, whereas somebody that just didn't have the authority or had the authority taken away isn't going to be as honest as that. So that's another reason to sort of it helps you move forward, because obviously you know why you didn't get in somewhere as well as why you did.
Brilliant. Thank you very much, Wendy. And like from our point of view, also as FemTech Lab, we partner with B2B companies sometimes, and it's also whether that person, again, depending on the type of partnership you're looking for, but whether that person has a budget themselves and can allocate allocate a small amount of budget first, and then maybe you can progress higher up. There is a question in the Q&A. Once you make sure that you have the right connection, so the decision maker, how would you understand how interested they are and not waste your time? Oana, I can see you're typing an answer.
Yes, I was just saying that we have literally been ghosted after a meeting with 6 department heads of a big pharma company. I mean, clearer than that, you can't, you'll know if they're interested. When someone is interested, they will want more information. They will ask for more meetings. They will be there for you if you ask another meeting and another one. So you will see the interaction. This doesn't lie. But I would like to piggyback on what Nishant said. In his case, with hospitals and department heads, this this is the ideal, right? When you identify the department head and you go straight to the target. But in the case of corporates, like big pharma, for example, it's much more complicated because you have a lot of department heads of the same department, but in different areas. So who do you reach out to? The headquarters, the US, Europe, Middle East, because they might need it more in the area, or how? It's very complicated. So the work is being actually multiplied because you need to reach out to several people, you know, just so that you don't waste time following a single channel and not getting anywhere. So I would love it if corporates would have a department just for that, for partnerships with startups, because this is the future. Startups are the future. So it would be lovely to just have a department, you know, and hey, where can I pop an email? I would like to send you a deck. Here, send it here. Just maybe someone hears that.
This is interesting, actually. I love when you said that you've been ghosted by so many corporates. Can you share? Because I think it's important, and what I love to hear success stories, and I think that goes to all of you guys, hearing like learning from what didn't work, and hearing some of those not so successful stories can be even more you know, more of a learning point. Can you share some of those tough ones? And maybe some of the lessons you've taken from there.
You're asking me personally or in general?
Everybody, feel free to jump, but since we are having a conversation with you, Oana, maybe you can.
I mean, it was, you know, I just couldn't believe my luck. It was a lucky strike. I reached out to someone on LinkedIn. They replied, I had a meeting and another meeting and another meeting, and they fell in love with the product. They were like, this is fantastic. Let me organize a bigger meeting for you. And she did. And it was a fantastic list of people, you know. I'm like, oh my God, I can't believe this is happening out of LinkedIn, you know. And we had the meeting, and the meeting went well, and 1 hour was not enough, and they asked tons of questions. So they were interested, like you could see they were interested, right? And they're like, okay, we need to regroup internally, and we need to discuss, and we need to think about it. Haven't heard ever since. I've tried several times. Nothing happened. I've reached out to each one of them. Nothing happened. No explanation whatsoever. It would have been nice, you know, like, you are not what we need right now, or, you know, it's an interesting product, but not now. Like I just said earlier, you know, sometimes the timing's just not right. But this lack of transparency and this ghosting was like hard to swallow.
Can be super demotivating. Yeah. And how do you kind of...
A piece of advice would be, don't take it personally, because I took it personally. I'm like, oh my God, I did something. We must have done something. We must have done something wrong. I don't think we did something wrong, to be honest. Now I don't think we did anything wrong. It was just like that.
Yeah, just circumstances can change, and you never know. Yeah, we had a similar situation where we reached almost the final stage of conversation, almost ready to partner, and then this person, there was reorganization, and the person left the company, and we had to start the whole conversation from the beginning, like literally back at the square one. Yeah, but then magic happens, and here we are, partnered with Essity, and really excited for our startups for that, and Wendy. I see there's a question. What was the rejection rate after entering DD with investors, acquisition partners? I'm not sure I understand the question. Okay, let me check the Q&A. When approaching a potential partner, would you consider using case studies to show how a partnership can work?
That's something I've seen work really well when you're moving into the employee benefits space, because the person you're dealing with, they need to be able to sell it to the head of HR and the head of the business. So if they have a case study to go on, that can be really useful alongside statistics. So I do think that's a good approach to take.
Mm-hmm. Thank you. I think the question about due diligence with investors, acquisition partners, so probably Nish, might be a question to you. Have you had any due diligence with other companies rather than Cooper Surgical, or was it a strike?
Yeah, I mean, for us, I guess if you're looking to exit, you know, one route you can take is when you're ready, potentially ready to sell the company, you may have a deck ready, prepared by your advisor, and you may then sort of go to the market, sort of officially go to the market and see what companies out there are interested. Or you can take sort of more of a private route, I guess, in our case, where we knew Cooper Surgical for many years, and we sort of started that initial conversation with them. And obviously we went through the due diligence process with them, and everything sort of went according to plan. It was a very sort of long, thorough, drawn out process, but they realized the value that it would add to their business. There were earlier on, even prior to FDA clearance of our product, we did have someone else reach out to us, and we're trying to they put an offer in for the company, but that's something we rejected at the time, because I think it's important. You don't have to take the first offer. We were quite stubborn. We sort of thought if we didn't get the right offer that valued our business correctly, we would go and do it ourselves. We were always very confident in that respect. We had other companies that reached out to us over the years that wanted to distribute for us nationally in the US, with the option to potentially acquire us a few years down the line. And when we got into those discussions again, we sort of walked away from them because it was very much unfavorable for us. We are sort of handing control over to the business. So yeah, they're not a huge amount of examples in terms of the offers sort of being rejected at due diligence stage, but I think that's why it's important to choose the right potential partner, so it's right for you and right for the acquirer as well. You shouldn't take the first offer you get.
I love that. Thank you very much, Nish. And I think what you said there is key, that you had an alternative strategy, so it wasn't like all eggs in one basket. So, and I think it's important to point here that whilst having strategic partnerships for the right reasons is super important, at the same time you don't devote, it's like fundraising as well, it takes a lot of time, a lot of energy and a lot of effort, whilst you still need to continue to build your business. So make sure that you allocate enough time to continue to drive your business forward, and also don't, and we covered this in the previous webinar, so definitely check out the other one, but don't partner for the sake of partnership, right? Have a clear vision why you want to partner and who you want to partner with. So we have 9 minutes before we need to close the webinar, and I would love to kind of, let me check. I think there's a question. How soon did you give up equity? Is that a question, Kim? Who is this question to? Is it to Nish, maybe? And there's another one, Nish, for you. Yeah, Nish. So Nish, how soon did you give up equity? And there's another one. Did Cooper Surgical tell you early on that they want to see you grow before they acquired you? Or what was the 8-year wait?
Well, I think there's, I'll answer the Cooper Surgical question first, I think. I guess it wasn't really an 8-year wait. I would say that they knew about us for several years. But they weren't in a position to acquire us in those early years, because we were very early on in our journey. And I think there were a lot of hurdles we had to get through before someone would come and value us correctly. One of those being the FDA approval. That was a huge milestone before any company would really place any meaningful value on our business. So it wasn't necessarily that we had to wait for many years. It was we continued doing what we were doing, and we just maintained a relationship with them. They sort of saw our company's progress over the years. And I think once we had the FDA approval, I think they did sort of indicate they wanted us to prove that we could bring our model to the US market. And we did that ourselves. We did that effectively on a relatively small scale. But it was enough for them at that point to then take us seriously and look at potentially acquiring us at that point. The equity question, I mean, we were fortunate in a sense. We didn't ever raise any money, any external finance on our journey with growing our business. We obviously, the sort of co-founders in the business had equity stake, but we didn't raise any external finance.
Brilliant. Thank you very much. So if there are no more questions, feel free. You have 2 more minutes to add last minute questions. But in the meantime, I would love to close with our usual question. Can you share one advice with startups trying to work with corporates? If there is one thing, what would it be? Feel free to jump, whoever would like to go first.
I would like to go first if no one else wants to go first. So I would say, first of all, be sure to follow up with persistency. When I started working for Proov, doing partnerships for them, I used to take things personally. And it's damaging to your self-esteem, to your brain in general. The thing is that the bigger the company is, the more likely it is for them to have other fish to fry. So they're most likely not going to bed every evening thinking about you and getting back to you. So you need to follow up persistently, without being pushy, but persistently. And you have to nurture the relationship. It's like I always say that in business, it's just like in life. You need to nurture the relationship. You need to make sure you keep the fire there. You remind them you exist. They have other things to do. You're most likely, since you're a startup and you're small, like we have all been startups and small, you're just a dot on their list, on their to-do list. So you have to come back regularly and remind them you're there. Just that, because they don't reply to your first email, that doesn't mean that they don't want to hear about you or they don't want to talk to you anymore. Just, be there and remind them constantly that you're there, that you want to talk, and don't take it personally. These things take time, for sure.
I'd also say in terms of keep checking in that it still makes sense to you, because as you go through the process, because when you are small and the potential partner you're talking to is much bigger, which is often the case, that's very seductive. They've got a lot of money, they've got a lot of resources, they can make a lot of promises, and it's very easy to sort of just sort of only see the shiny stuff and to not see any potential red flags or even orange flags that you're like, can I actually work with these people? And do I like this mission? Do I like, just the vibe of working with them? So if there is an opportunity to, like we're doing with Essity and the pilot, to kind of almost trial that process, and to not rush to it and take the first offer, but rather to sort of, well, let's try this route first, and sort of just test it, because they're people too. They will have a very different culture to you. They will have a very different workflow. God, if I see another Microsoft Teams, I'm going to scream. It's like, working when you're a startup, you use different systems to corporates, and it's just kind of getting used to you're thrown into the middle of their politics. They've got politics, they've got agendas, they've got other priorities. So just kind of keep checking in that it's not just the shiny stuff and that it actually still makes sense to you and it's what you want.
I love that. Thank you so much, Wendy. And what we always also find in our own experience is we talk about how you can help the company, but sometimes it's also the individual person's agenda, that specific person that you're talking to, they would have their own agenda, and kind of understanding that gives you extra advantage. Right. Thank you very much. Alison, Nish?
Yeah, I mean, you got to go for it, Alison. Yeah.
Oh, great, thanks. Yeah, I think going to Wendy's point, not every fit is going to be right, so be aware of that. But I think a good starting point is focusing it on the client, not necessarily you and your startup, because you will lose people in the room when you do that. And you also lose the opportunity to ask open questions about what good looks like for them, that you might then think, actually, that's not what good looks like for me. And to Wendy's point, you just decide it's not right.
100%.
Yeah, I think for us, one of the important lessons we sort of learned, if we look back now, was just building relationships early on. I think for us was very important, because whether it was building relationships with companies that may look to acquire us one day, whether it was looking to build relationships with clinicians, because sometimes we'd speak to clinicians and at that point they may not be interested, or they've got too many other priorities that our product's not top of that list. But actually maintaining those relationships early on, we had clinicians would come back to us a year or two later and say, oh, we should really consider this product now. And it's because we sort of maintain those relationships. And also with our partners the distribution partners, these were long-lasting relationships that were very important. We had to go and spend a lot of time in the field with them, helping them in terms of how to sell our product and articulate the value to doctors. So I think for us, it was really investing in relationships early on, I think had a huge impact for us.
Brilliant. Thank you very much. Thank you. I think we are almost at the end of the webinar. Thank you very much again for taking the time, for sharing your wisdom, and also really grateful to have you as mentors, and can't wait. We're kicking off the Accelerator on 1st of September, and hopefully we're going to have you all back helping our startups. And I think this is so important, listening to your successes, that you still take time to give back to the earlier stage startups and sharing your wisdom with our startups on the Accelerator. So forever grateful. Nish, your session for the last cohort was one of the most popular ones, and Wendy, your lessons learned were just incredible. So thank you very, very much. Looking forward to have you back on the program. Thank you everybody who joined us online. This session is recorded, so we'll share the recording with everybody, and hopefully see you back at our next webinar.